reform as a way to make more money. Thank you for considering my views.
Thank you, Mr. Potter. Ms. Cramer. Thank you.
Thank you. Good morning, Madam Speaker, Chairman Miller, and Chairwoman DeLauro, and other members of the committee. My name is Bonnie Cramer. I am an AARP volunteer, and I am chair of the AARP Board of Directors. I want to thank you for your commitment to enacting health reform legislation that will ensure that older Americans are not denied the affordable coverage, and that will protect Medicare benefits for seniors by eliminating the waste that is driving up the cost of health care for everyone. Today I am proud to be here representing nearly 40 million members of AARP, half of whom are over the age of 65 and participate in the Medicare program, and half of whom are under the age of 65. Both of these groups face serious problems in today's healthcare system. As many as 7 million of all persons aged 50 to 64 are uninsured today and losing jobs every day, and people in Medicare are spending 30% of their income on health care. As you know, AARP greatly values the views and opinions of our members. We spend a good deal of time talking with them, meeting with them, and soliciting their input. Just since August, AARP has engaged over 1 million of our members all across the country in town halls, in teletown halls, and community events. We've listened to their concerns, their ideas, and their solutions. As you also know, we hear confusion, frustration, anger, and in some cases desperation. Some have fear about the legislation being considered by Congress, and many others have hopes that it will help to solve their problems with the healthcare system. At AARP, we believe that healthcare is not a Democratic issue, it's not a Republican issue, and it's not about political gamesmanship. It's about people's lives. That's why we believe that healthcare reform must fix what is wrong and preserve what is right. We have been working hard to cut through the noise and find the facts about what healthcare reform means for our members and their families. Unfortunately, some groups have been using scare tactics, such as the notion that healthcare reform would ration care, would hurt Medicare, or result in a government takeover. These statements are just a few of the many falsehoods that are being spread and as a block to the enactment of healthcare reform. Our most recent AARP bulletin, which goes to all of our 40 million members, helps to dispel many of these myths, and I've brought along copies to share with members of the committee. I'd like to share with you now what our members have told us that they want out of healthcare reform. First, we must end discrimination by insurance company. Like millions of older Americans, too many of our members have been denied coverage because they have a pre-existing condition. Others have fallen victim to insurance companies that use their age as an excuse to charge exorbitant rates that they cannot afford, leaving them without coverage. Our members want the peace of mind that comes with knowing that healthcare reform will ensure that they can no longer be denied coverage because of their health and age. AARP strongly supports the House provisions to limit age rating to no more than a 2-to-1 ratio. We have serious concerns about the adverse impact on AARP members and therefore cannot support other proposals under consideration that would allow insurers to charge older Americans 5 or more times higher premiums than others simply because of age. Age discrimination is just as inappropriate as discrimination by gender or medical history. AARP believes that if age rating is not seriously constrained, it could simply become another way for insurers to underwrite their policies and select only the healthiest and youngest individuals, leaving our members to face rates that many will not be able to afford. AARP also supports providing subsidies included in the House bill to individuals up to 400% of the federal poverty level. Without these subsidies, many of our members will not be able to afford coverage or the cost sharing for covered care. In addition, AARP believes that all income groups receiving the subsidies should continue to get the protection on premiums up to 11% of income at a minimum, and that was provided in the original bill. We believe that efforts to increase these percentage limits or decrease the subsidy levels will erode the affordability protection of the credits and will mean that over time, more people will find insurance unaffordable. Second, health care reform must protect Medicare by ensuring seniors get the benefits they've earned, closing the Medicare Part D donut hole, maintaining patients' access to their doctors, and strengthening the Medicare Trust Fund by eliminating fraud and wasteful spending. An important part of health care reform is protecting Medicare and getting better value for both Medicare beneficiaries and the federal government. We have pledged to our members that we will not support any health care reform proposal that does not protect Medicare, so seniors continue to get the benefits they've earned and their children and grandchildren have the health coverage they need when they retire. Any final health care reform plan must use savings from removing waste, fraud, and inefficiency in the Medicare program to close the Part D donut hole, to pay doctors more fairly so that our members can continue to have access to the doctors they need, to improve the care by covering more preventive services such as cancer screenings, and to keep premiums fair and hold down out-of-pocket cost. Third, health care reform must protect consumers and choices by making sure that no one will get between you and your doctor, not an insurance company and not the government, and that no one will tell you which doctor or which treatments you should have. People's health should not take a backseat to insurance or to drug company profits. Fourth, health care reform should guarantee stable, affordable coverage by ensuring all Americans have the security of knowing that if they lose their insurance because they lose their job or because they change jobs, they will be able to get affordable quality health insurance. I'd like to close by dispelling one more popular myth. Health care reform is too expensive and we cannot afford to fix it. The fact is, if we do nothing to fix health care, families with Medicare or with employer-based health coverage will likely see their premiums nearly double again in the next 7 years. If we do nothing to fix health care, the share of family income spent on health care will also nearly double in the next 7 years. When 1 in 3 Americans say that someone in their family skips medication, postpones or cuts back on needed medical care due to the cost, when countless bankruptcies are related to medical expenses, when the number of uninsured continues to rise, when government spending on health programs rises so rapidly that it jeopardizes other priorities, and when employers struggle to pay for the cost of health care, the fact is we cannot afford not to fix health care. Thank you again for your continuing leadership to improve our nation's health care system. I appreciate the opportunity to testify on behalf of AARP's 40 million members.
Thank you very much. I want to say thank you to the entire panel, and let's move to questions. And just